you sort of people trying to park or whatever. So welcome to our next staff meeting, and today we're going to have two special speakers.
Come in. Hi.
Hello.
Sorry to interrupt.
Here's the celebrity.
So what we're going to do is have two special speakers who I'll introduce in a minute. But after the meeting, after the speakers, we're going to have a meeting for all the members or everyone's here to bring everyone up to speed. So I'd like to introduce Dr. Gary Rance, who's going to talk about hearing problems with people like me and other people in the room.
All right, thank you for the invitation. Hello everyone, good afternoon. Let's get out of this one. The reason I'm here today is that I'm proposing to do a study next year with some of my students looking at hearing problems in people who have various scar disorders. So I thought I'd come along and give you some idea of what it's about and give you an opportunity to ask some questions if you're interested, and hopefully encourage some of you to participate. So just keep going. Alright, so it's hearing problems in people with scar. I should also explain I'm also an artist as well as being a scientist, so there are a couple of art-related references as we go along here.
You've been copied.
Yeah, I don't have any of my own work in it. Alright, so just to introduce myself, I'm an Associate Professor at the University of Melbourne, where, amongst other things, I run the School of Audiology. And audiology is an allied health profession where we're basically looking at testing hearing in people of all ages, and looking at balance problems and various other issues related to the ear. I mainly do research these days, although I am also a clinician. And I hold the Wagstaff Research Fellowship in Otolaryngology, which is a clinical post based at the Eye Hospital, which is where I do much of my clinical work. Okay, so the project then is looking at hearing problems in people who have scar, and this is part of a broader study that we've had going for a number of years now, looking at various different types of neurodegenerative diseases. And we've been looking in particular over the last 3 years at Friedreich's ataxia, which some of you may know something about. Next year we're going to be looking at Charcot-Marie-Tooth syndrome, which is another. And we've also been looking at some combined visual and auditory neuropathies, so neural problems going on in the visual and the auditory pathway. And some of these are Leber's optic neuropathy and autosomal dominant optic atrophy. Okay, so scar sort of fits within this broad group of disorders. And what we're interested in looking at is auditory processing. So it's not necessarily how the ear is working, but the way the signal gets from the ear up to the brain. And it seems that certainly in the Friedreich's patients that we've seen, and I'll show you some results in a moment, in the Friedreich's group, the ear can be fine, but the signal gets distorted as it moves from the ear up to the brain as it passes through the nerve. And that's the sort of problem we're looking for in the scar groups. Okay, so as I mentioned, the Friedreich's group we've been looking at for a couple of years now. And just to summarise the findings, broadly these people have normal sound detection, so they can hear very soft sounds without any problem, so their ear is working fine. But there's something unusual about the way the signal gets from here up to the brain, and again that's what I'm suspecting might be happening in some forms of scar as well, and that's what we want to look at. And this is an area that hasn't been investigated before in the way that we're going to do it anyway. Okay, with the Friedreich's groups.
Sorry, T. You have to stay there, I think.
Okay.
Oh, you can hear it.
No, there's grip on that. Okay. So one of the particular problems that we've found in people with Friedreich's ataxia is to do with their understanding of speech. So again, they can hear very soft sounds, but their discrimination or their understanding of what is said to them is a real problem, as I'll show in a while. Particularly if there's some background noise. So I'm not sure if that's a problem that you guys come across, but certainly that's the kind of thing that we're looking at. We're looking at what the consequences of this type of hearing problem might be, and then also what we might be able to do about it as well. Okay, and just again to summarise the Friedreich's results, we've tested 30 people with Friedreich's ataxia, and every one of them had a problem with their speech understanding. So all of them had something unusual about the way the electrical signal got from their ear up to their brain. Okay, so why do we think this is worth looking at in SCAR patients then? Well, there have been a couple of studies that have looked at auditory function in SCAR patients, particularly at the neurological function, so the way that the auditory nerve works. And I've just listed a couple of them here, and in fact a pretty high proportion of people who have been studied, maybe 50 to 80%, have something unusual about the way, again, the electrical signal passes through the auditory nerve. Now, interestingly, none of these studies have looked at what that means for someone in terms of their day-to-day life, what their perception is like, but they're all, or a high proportion of these people are showing that there's something funny about the auditory pathway in some SCAR categories. Right, so again, none of these studies actually looked at auditory perception, which is what we want to do. So this project then will involve some sound detection, so a standard hearing test, can you hear very soft sounds or not? Then measuring electrical responses from the auditory pathway. This is the auditory brainstem response, which I'll talk a little bit about in a moment. Some auditory processing, which is looking at the way basic elements of perception might be affected by SCAR. And speech understanding, so again, what the actual consequences of this form of hearing loss might be. And then habilitation, so if we do find some problems in people with SCAR, then we might look at what we can do about it, how we can make things better for people who are affected. Okay, so I'm just going to go through some of the assessments for you. First thing to say though is that all of the tests that I'm going to talk about have ethics approval from the Eye and Ear Hospital Ethics Committee, and they're all non-invasive. There's certainly nothing painful or even uncomfortable. People often fall asleep in the middle of these tests, and they're all based on standard clinical tests, so there's certainly nothing sort of dangerous involved in it at all. They're all run from a laptop computer, which means that we can be portable where we do the testing. And certainly with the Friedreich's ataxia group, we've tended to do most of the testing in people's homes, so we can go to them and do it in their lounge room, which is obviously makes it a lot easier to do. Alright, so just going through some of the assessments then. Firstly, I wanted to talk about the auditory brainstem response. This is one of the tests we'll be doing. And these are electrical responses to sounds, a series of clicking sounds, that are measured from the auditory pathway. And these are responses that are recorded via sensors that we stick onto the scalp. So there's one on the forehead, one behind the ear, and one usually up on the temple. For this test, the subject doesn't have to do anything. In fact, it's better if they go to sleep during these circumstances, because we're trying to measure responses from the brain. So we want to see particularly what's happening in the auditory part of the brain. And it takes about 20